Hello, this is Dr. Maria Sulindro, integrative anti-aging, practicing in Pasadena, California. Happy New Year. With me, I have a guest, Dr. Cynthia Shelby-Lane, practicing integrative anti-aging medicine in Detroit, Michigan. Hello, Dr. Cynthia.
Hello, Dr. Maria. How are you? And Happy New Year.
Happy New Year. It's good to see you for
You
our
too.
first video here. Thank you for spending time and sharing with us about our important topic today. So allow me to introduce what we are going to say today, and then I will start with some questions so we can share this knowledge with our audience. So I hope this year will bring us more freedom in health. But looking back, we should have some overview of the 2020 so we can kind of be reminded what we had, why we have pandemic. And let's start with December or January 2020. Staff and my patients were having flu, heavy load flu cases. In January, Wuhan reported the strange virus. CDC says 3 US airports start or begin screening for coronavirus. First US COVID patient case was confirmed. By end of January, Wuhan, China was under quarantine. Chinese New Year was actually fall on January 25th, but the national vacation started on January 15th, that weekend. So people from China were already spending their 2 weeks vacation out of China everywhere in the world, unfortunately. So in February, public emergency, global health emergency was followed by lockdown. March 11, we announced pandemic globally. So in March 6 to 21st, we have cruise passengers tested positive. 3,500 people of California coast test positive. 19 were crew members. This was Princess Cruises. Hydroxychloroquine was tested in University of Minnesota then. And there was also report of eye transmission. In April and May, remdesivir accelerate recovery in the hospital, they claim. But US death was already 80,000. By June, Lancet and New England Journal of Medicine both retract the 2 studies of hydroxychloroquine. In June, we have 2 million cases, 100,000 per day. In July, we locked down at home. In August, ICU room is lacking. We didn't have ICU room. US reached the 3rd leading cause of death. In August, first case of reinfection. He was 25 years old in Nevada, and his first infection was in April. The second reinfection was worse, and this was all published in Lancet Journal Medicine. By September, Trump administration relieved vaccine distribution. We'll talk about that later. Death reached more than 1 million. By October, 31 states spike cases, 40 million worldwide cases reported in Johns Hopkins. 1 million died, 220,000 is in US alone. The FDA released EUA, which is emergency use authorization, approved remdesivir as COVID drugs. COVID was 10,000 cases a day already. By November last year, EUA, Pfizer vaccine was approved, 90% effectiveness. We'll talk about vaccines later. And Eli Lilly antibody treatments of monoclonal antibody for COVID was also EUA by FDA. By November, vaccine, there are several vaccines which we will share with you today. By December, we have another one, Novavax, okay, in phase 3, done in Mexico and USA, and AstraZeneca vaccine. And first US variant also was found in Colorado. The plan was to vaccinate 20 million people by December, end of December, but we only reached 14 millions in USA. We'll talk about distribution. Dr. Cynthia will share with us. Now, I think we have to have disclaimer here, Dr. Cynthia. We are both not expert in vaccine nor expert in, we are not infectious disease doctor or immunologist. We are integrative anti-aging medicine doctor.
Correct.
We will share with you what we do in our office and how we handle our patient, correct?
Correct, yes.
Okay. So Dr. Cynthia, the first question I have here, what kind of wisdom do we get from all of the 2020 overview? And you must have some advice so we can be more wise.
You know, my wisdom comes from actually, number one, being a physician. Number two, working in the inner city of Detroit. Number three is reading all the literature over and over again. And then just watching this whole 1 year that you just described. It's an incredible year that we've gone through, a lot of breakthroughs, a lot of death, a lot of morbidity and illness. And the one thing I like to say is that it seemed like when we take care of patients, it's all about out there. We're going to take care of patients. We're going to take care of them. But now it's us, our families, it's physicians, it's the home body of nurses, respiratory therapists, every frontline worker. So everybody needs to be involved. It's not just science on one side and you do what we say. It's not pharmaceuticals. It's not surgery. It's really self-care and understanding how to do that. So I think as we go through this conversation for the next few minutes, that going to help everybody understand what strategies you can do to optimize your immune health and how you can monitor symptoms if in fact you do test COVID positive or if you live with someone that's COVID positive. And then we'll talk about what's on the horizon. In addition to kindness, which is the main reason why I was here today. So kindness. So what I want to address is that people who are at risk still have these comorbidities. If you have a body mass index of greater than 35, if you have chronic kidney disease, if you have diabetes or hypertension or an immunosuppressive disease, or you're on the treatment for an immunosuppressive disease such as cancer or autoimmune problems, or if you're greater than 65. Those are some real big issues that we still need to address for people who are at risk. And that's not to say that children aren't or young people aren't, but this is where most of the data has come from for 2020. And then if you're over 55, so we just take the number lower, if you do have cardiovascular disease or hypertension or any respiratory condition, I have to interject here that I've lost two very important people in my life, and they're both Black men, and they're over 65, and they had hypertension, and they were well one day, and then they're gone. So this is dangerous, and we want to address it in a logical manner. There's a lot of information on the internet that you don't know what to do with, what to trust. So hopefully we can guide you through that, and you'll know where to get reliable information from.
Oh, yes, yes. It is very sad, especially those comorbidities for, all the patients that are having all this problem. They must be so worried about what is their chance of getting it.
Right.
So, and, with the new variant especially, and where other countries are getting it as well, what do you think about this new variant that is more virulent and very catchy and fast? How is it being detected? And it's more dangerous, we know, who is more susceptible, and why is it so dangerous?
So the susceptibility is probably related to the fact that it is more transmissible. So therefore, it's adapting to the human body and to our own immune system, and so it's converting itself. And there's mutations all the time with viruses because they get into the cell and they replicate themselves. So they sort of hijack your cell and this cellular biology. But this one is more according to the data so far, and we're really only into this maybe about a week or two, although I think this was identified in the UK later last year, later in 2020. Doesn't even seem like it's 2021. So like last year, 7 days ago. And then so there's a variant in the UK. There's also a variant in South Africa,
Yes.
and that variant has been found in at least 6 states in the United States as of January 7th of 2021, and they're still looking. They're testing every day. The testing companies are looking to what this variant is doing and how it's reacting in our bodies and how it's taking over our innate immunity and our adaptive immunity. So that's it's something to that if you go to the CDC, you can probably find out what's going on. CDC is just guidelines, but they do give you a place to jump off from to figure out what else should I do and what else should I look at. So this new variant is dangerous, is highly transmissible, and you still need to do all the precautionary things like hands, face, and space.
Yes, yes. We still have to more so doing those isolation and distancing. And now I feel that with the new variant, I hear more and more like closer uh, friends or relatives gets it. And boy, they are younger and not
Yes,
only older people.
right.
So we know about some supplements can protect us from getting COVID, and studies have suggested that a certain level of vitamin, such as D, cut the mortality. Let's discuss about these supplements since this is our area also of expertise.
Okay. When I think about strategies for optimizing your immune system, one is the supplements, and they help to optimize and boost your immune system. The and let's go through those quickly. Vitamin D is the one that has the most research behind it.
Right.
When,
Yeah.
when they looked at, there's a study in India, a study in Spain, and they looked at the level of, especially the one in Spain, they looked at the level of vitamin D in those people who were doing very poorly and those people who died. And their vitamin D level in their body, which is measured by blood test, 25 hydroxy, they found that those persons and patients levels were less than 20. Uh, and that's always going to be true, especially if you live above the 35th parallel. So that's where we have less sunlight. Those who did better or fared well, even over the age of 50, had a vitamin D level in their blood of 75 or greater, 75 to 100. So it's a narrow range. You don't want to become toxic because you can, because it's a fat soluble vitamin. So vitamin D has some data behind it to support its use and optimization. I think they did randomized control studies as well. If you're going to use vitamin D, you might want to add K2 as well, because vitamin D shuttles calcium into body systems and arteries, and so K2 can block that. On the other hand, if you're on blood thinners, you want to be aware, because K2 may change the metabolism of your blood thinner.
Yeah.
In addition, be careful if you have autoimmune disorders or sarcoidosis. So those are some ideas about vitamin D and how it's useful and how it's been studied. So get your vitamin D in, get your doctor to test your blood, uh, make sure you're not deficient. They looked at most of the people and they are deficient, even if you get sunlight, and Black people don't convert as well. So most African Americans or darker skinned people are vitamin deficient.
Yes, yes. I did check on the um, toxic level of vitamin D3. Actually it's 300. Okay, so if you reach your vitamin D level to 80 or 100 is still okay, not to be panicky, even though the lab will show that it's abnormal high. But I think it's good for this type of situations. I still remember a few years ago I was arguing with some doctors who said that 30 is okay. I said no, 30 is
No,
okay. No,
no,
no.
no.
So I usually give at least, for people who are above like 35 to 40 years old, I give like 5,000 IU every day and then check the level. Thank you
Yeah.
for all that sharing about these vitamin and supplements. I also give zinc. Don't you give zinc?
Yes,
Yeah, yeah.
zinc. So elemental zinc, you don't want to get too high on zinc. And I always wonder if you take zinc for these times, like the flu time, from end of the fall into spring, do you really need to take it all year long? But they're saying that elemental zinc no more than 40 milligrams a day is probably good enough for most of the year. Again, got to check with your doctor. We're not giving out any advice. You do need to check with your doctor because
Yeah,
there could be side effects and you could be on other medications and you don't want to get toxic from any of this. The thing with the zinc is that if your zinc levels go too high, it'll decrease the utilization, or I think metabolism of copper and iron. So yeah, it's a balance.
I see. So I usually give the same, like 40 to 50 a day.
Mhm.
It's because this zinc inhibit the replications or stop the replication of, help to stop the replication of the virus.
Virus, right.
Sometimes I give also vitamin C and quercetin.
Quercetin, good. Yes.
Uh,
Yeah.
so, okay, I think we can share this. And what about, okay, I would like to check a question, okay? So
Okay.
one question here. Can you share with us symptoms of COVID first?
Okay.
So let's share the symptoms of COVID.
Okay. So symptoms of COVID. So for the past year, they've been taking temperatures all over the world. So one of the most commonly reported symptoms is fever. And that is a common symptom of the body trying to shed the virus. The body knows what's going on. So fever was the most commonly reported symptom. Then there was cough. There's nausea, vomiting, some diarrhea, fatigue. There's also loss of taste and smell, and there's shortness of breath. So by the time you get to the level of shortness of breath, you're probably past the incubation stage, which is 5 to 12 days. So you may have gotten the virus, had no symptoms, and from day 5 to 12, you're going to start to see something happen. You may start developing symptoms at day 5. The virus has been in your body, and then these symptoms will start. So you're going to look for fever, you're going to look for fatigue, you're going to look for nausea, vomiting, all those things that make you think maybe you have the flu. So it's a little bit different because the flu, they used to say COVID hit you faster, but now they switched it to the flu symptoms come on sooner and they hit you within 48 hours and then they kind of go away. This COVID has a longer time in your body. That's why when you can shed the virus because you're asymptomatic, and those are just facts.
Yeah, some people are asymptomatic, but it doesn't mean that they don't carry the virus.
Right.
That is the most dangerous. Actually, they found out that if you are asymptomatic, because you are able to uh, bear this virus, so
Right.
you're more contagious, you're
Yes.
more infectious, to other
Right.
people.
That goes back to like your innate immune system versus your adaptive immune system.
Correct.
So
Yes.
what you're born with, what you have innately, the monocytes, the macrophages, they grab stuff, the natural killer cells, and then there's this other system of the B cells and the T cells that come on board a little bit later, and it's more adaptive. But as we get older, our innate system gets weaker, our adaptive system gets stronger, but if you had a lower innate system when you got this virus, you're not going to fare well because it's interfering with interferon. So that's kind of like the cellular biology is so much fun because you get to understand the path. You have to take care of yourself. You really do have to take care of yourself. So what we're talking about, we didn't say water, we didn't say hydration, but those things were important too. So nutritional supplements in particular are very important as you go forward. People want to know, what else can I do? What else can I do?
Yes. For us, I think we don't like this COVID era, but it teach people how to improve their immune system, how to be
Right.
clean, and so I think I like it in that kind of aspect. Okay. So thank you for sharing about that and how to isolate people. When you talk about this asymptomatic and symptomatic, and so how to isolate people if they are COVID PCR positive
Right.
and okay, you want to share with that?
So isolation and a reduction of the spread of the illness is really important. Say, for instance, you're COVID positive, the mild symptoms, you're probably going to continue on the same vitamin regimen and supplement regimen we just talked about, plus sleep. If you have symptoms and somebody else in the house has symptoms or anybody that you're around, You need to prevent the shed of the virus. You need to isolate yourself in your home if you can. I understand that some people don't have huge houses and some people are living more to a capacity of 2 to a room, but you still have to do the best you can to self-isolate. You need to wear your mask. You need to wash your hands. You need to eat from different utensils. You need to get sleep, 7 hours of sleep. People who got sleep were better able to receive the vaccine 7 hours than those who are not rested. It's difficult, but if you don't get those things going, ventilation, HEPA filters, isolation, and all the hygiene, then if you don't get that under control, then you get to the point where you need to check your pulse ox, if you can buy one of those over-the-counter pulse ox meters, and make sure you're above 95, and you need to possibly go to the hospital or the emergency room. Those are the symptoms. That's the progression. It could be slow, and then all of a sudden you just like happy oxygen, like okay, and then it's gone. So just being able to be aware of your symptoms, the progression, take your temperature, isolate, take your vitamins, nutrients, stay well hydrated, but not spreading the virus is really important, because you can get reinfected. In case people had it and didn't know that, you can get reinfected. People think they can't. They think they built up this immunity with their B cells and T cells. On the other hand, people have gotten reinfected, such as you mentioned, Dr. Maria. Remember that the young man, 25-year-old?
Yes, yes. So basically, isolations is the same thing like what we have emphasized for the whole year. Wear your mask, wash your hand, and be clean. And but if you are symptomatic, call your primary care physician. And if they want to prescribe medication, okay, some papers lead us to these medications. Some medications, this is being used right now, and ivermectin, doxycycline, and AZ-Pack, or some people combine it with steroid because of the anti-inflammations.
Right.
So make sure don't just handle it yourself if you're not comfortable. I heard Dr. Cynthia, because of COVID, their doctors are not reachable because they're busy, and these doctors can be sick too.
Yes, right. Absolutely right.
We
It's
are
not out there, it's all over. That's right.
correct. It's very sad. Okay, now, because of 2021 and we are in January, the whole world is talking about vaccine. There are so many vaccine enthusiasts now. And also the frontliner received their vaccines already. Those are doctors, nurses, and healthcare that handle COVID patient directly. And they give some good testimonials, and some are just a few here and there videos talking about the side effects. Story change day by day. Someday people get discouraged. Someday they want to be in the front row and line up for 6 hours to get vaccine.
Yeah.
It's the latest nutshell, since this is just released. You want to share with them?
So the vaccines that have been rolled out so far, and they're being rolled out slowly in the US, they did better in the UK, according to the data. But our vaccines are Moderna and Pfizer BioNTech. Those are both mRNA messenger viruses that you're getting replication of the message in your body, so your body can produce an antibody. So it's not the virus itself, it's a replication mRNA messenger. So it's real genetic coding. But this rollout has been slow, and that's because people are skeptical. Some people are skeptical. They don't want to know. So they didn't want to be first. Now they do want to be first. The first shall be last. The last shall be first. It's in the Bible. There's not enough staff for rollout. There's the allocation problem, the distribution problem in the United States, because several levels of care, from city to county to state and then nationwide, we just have to keep up with what's going on. So it's going to catch up, I'm assuming. And then they just, so I'm in Michigan, they just gave a rollout for 75 to 65, 65 to 55. So they rolled it out older and more prone Yeah, and so I'm on the list. I'm
I'm,
still, I'm
I'm,
still waiting.
I'm on the list too. But
Yeah.
in Michigan, they started with the 75 and above.
And the city of Detroit. So that's what they did in Detroit.
Uh-huh.
Another county. So remember, it's city, county, statewide. And so that's why there's been so much confusion with distribution and allocation and who gets it. I guess you heard in the news last week, a pharmacist who was an anti-vaxxer destroyed vaccine that would have been 500 doses. So there's a lot of confusion. And just to get it organized, people are afraid. So what are they afraid of? You're putting another genome into my body. So it's not doing that. It's not changing your DNA. It's a messenger. It's like a post-it note. It'll go there, it'll get the message, and then it's gone. So you have some immune protection. If you had COVID-19, do you still need the vaccine? Well, COVID-19 antibodies don't necessarily, like convalescent antibodies, you may not have high enough antibodies. So yes, you may need the vaccine. And can you have a reaction? You can have the usual reaction of a vaccine, like pain at the site, fever, fatigue. If there's anything else, Maria, tell me. So those kind of normal reactions from a vaccine.
Some,
But
some of them they have weakness actually because this vaccine when they give it to you, you experiencing a milder symptoms of what you expect to have
right,
COVID. Yeah, like
right.
COVID. Now, what about these? You know the the allergies to vaccines.
Okay,
Let's
so
let's
the
talk about that
the
one.
biggest allergic reaction that's been reported so far, 29 cases, I think, in the U.S., has been anaphylactic reaction. So you get short of breath, or your heart rhythm disturbance, and you'll pass out. So the treatment for that is, number one, if you know that you have allergies, multiple allergies, drug allergies, etc., you probably want to go to get your vaccine at a place where they can administer Benadryl and epinephrine. You don't want to go to the local CVS or Walgreens once that becomes available, because who's going to take care of you? So you want to be in a setting where you can get taken care of. But there's been 29 cases so far reported, and I'm sure those are making the headlines, the media, but uh, the incidence of penicillin reaction and peanut reaction is much higher. People react to that, and you don't hear that in the headlines. So I think as we go forward, you look at the vaccine, what it's doing. It's a new generation type of vaccine. It's new technology. You have to give it a chance. And if you're out there, there are 2,000 people dying a day. So this is pretty bad. The incidence of an allergic reaction in for Moderna and Pfizer is 11.1 to a million. For the flu, it's 1.3 per million. So it's a little higher than the flu, but it's new technology. It was developed, and don't let the word new scare you. It's just that it has been vetted, phase 1, phase 2, phase 3 trials. The CDC and testing companies are keeping up with what's going on. When people have a reaction, they're looking at it. So it's controversial, but I can tell you, has so far reported things say it's 95% efficacy, and I think that's pretty good.
Yeah. Yes, I think it's very good. And you know, there are how many types of vaccine? Aren't there 6 types of vaccine?
So there's Pfizer, Moderna, Johnson and Johnson is rolling out a viral trial. There's AstraZeneca, Oxford out of UK, and there's Novavax, and there may be another one. Every day I get up and there's another vaccine on the that's undergoing clinical trials.
The
But
one that is actively given is Pfizer and Moderna.
Pfizer and Moderna, mRNA. The AstraZeneca is adenovirus. It operates a little bit differently, but it still replicates mRNA. And
And
I'm not that familiar with
so,
Novavax, but
so we can share what we know that, you know, each vaccine have their booster. You have to
yes,
have
yes,
the second injection. So for Pfizer is 3 weeks, am I correct?
correct.
And for Moderna is 28 days or
28
4.
days. And for AstraZeneca, it's supposed to be 28 days, but they tried to extend it in the UK to 12 weeks, but they don't really know if you're replicating properly. So it really, we're saying 21 days to 28 days for all three at this point, as opposed to trying to ration the vaccine, give half now and a dose later, a full dose later. All of those things have happened. All those things are happening. But the theory is get your initial vaccine and then get the booster within 3 weeks to a month later
Yes.
for
So
protection.
have we talked about who shouldn't be vaccinated?
People, I'm assuming people with severe allergies, people
And
who are immunocompromised, they have to talk to their doctor to make sure there's no conflict. But I think the allergies are the biggest issue at this point in time. That they haven't found it, and I have to do more research, but I don't think they've found another reason for you, except for just fear. There's a lot of fear. There's a lot of fear. Fear is everywhere. So.
and when we reach the herd immunity, that's about 70% of the population being
Yes.
vaccinated. I
Right.
think estimate in United States it will be like 7 to 8 months.
Right.
And
Somewhere in the fall of 2021.
yes, so in a country like Indonesia, we talk about this tomorrow. I
Yeah.
think it's about like 12 to 15 months. Yeah, it's almost
Oh.
the same population. Yeah.
Uh-huh.
Now, Dr. Cynthia, let's talk about post-COVID syndrome
Okay.
because some people think that once they get COVID, they are immune forever. So this is quite dangerous. So
Right.
let's talk about that one because this has something to do with the mitochondria affection.
Right. So people who get COVID, and then they survive, so they recover. Those are recovering people. Some of them go on to have, and it may depend upon your innate immune system as to how well you were able to manage to recover without a vaccine. So there's no vaccine, you recovered on your own in your body. But people are noticing fatigue. They're very tired. And some athletes, they saw studies where athletes were trying to exercise and practice at their same level, and they couldn't. They were just tired. And that's from an underlying condition called myocarditis. They found those in some people who are recovering. So there may be some inflammatory lung changes and inflammatory cardiac changes, and that may be directly affecting the mitochondria. More studies, more research needs to come in because I'm seeing patients now who say, I just can't think, I'm tired. What should I do? And then you have to go back to nutritional therapies. And of course, you and I both look at the mitochondria. And if you start looking at inflammatory factors, you might find out that they're still very inflamed. Things like interleukin 6 and TNF alpha, those kind of things. So I think there's going to have to be more studies. I don't know that the primary care doctor is even prepared at this point in time to say, oh, you're fatigued, it must be COVID, and then go on and then go home and get some rest. There's more studies to be done. And the studies are coming day and night. I mean, the world is on fire with the research that's being done around this virus.
Yeah, I feel like I'm very fortunate to understand about how to treat patients with natural anti-inflammation, like
Right.
for example, turmeric and glutathione or cat's claw, because it is very important to continue reducing the inflammation that is still probably going on after
Right.
they have the infection. And many people do feel fatigued and tired with low energy. So we
Yeah.
also have to also support their adrenal.
Right. Right.
Yeah. So, how long do you think, how long does your immunity last after you get vaccinated?
Oh, so they don't know. And they're thinking maybe you need a yearly booster. They don't know. This
Oh,
is all
yeah, yes.
they don't know. This it's the I'm the last one to tell you. Well, but the immunologists and the virologists and the infectious disease doctors and pulmonologists, they're putting their heads together to try to figure out if you get a vaccine, how long does it last? If you got COVID, how long does that immunity last? Can we do antibody tests that are going to tell us what happened inside your body? Are your monocytes still low? Is your interferon level still low? There's a lot of questions, a lot of good questions, and I'm going to follow the best. I'm just listen to them and read every day.
Yes, yes. I would like to also make sure that some questions here asking about is there any news, hoax news about this that is not a virus and it is bacterial. So maybe we want to share with them that there is a bacterial mixed infection when they have COVID. That's the
Yes.
reason why the antibiotic also is given when they are in the hospital,
Right. And
right?
that's because of the way the COVID virus
Yes.
attacks the alveoli and the lung cells, and then they make them weaker, and then there's little gaps inside. So that's where bacteria can infiltrate, and so then you get a co-infection. So you not only have a viral infection, you also have a bacterial infection. So those incidences are occurring, and that's why people get antibiotics as well.
Yes, yes. So, okay. Now I think I know you have mentioned about distribution of vaccines, and some doctors they probably would like to give vaccine also in their office. But that is a good point to remember that if you have ever had an anaphylactic shock and allergies or anything like that, is to get it from the place where the doctors or the healthcare providers able to give you an injection to reverse.
Yes, absolutely.
Mhm.
Yes, and it works. Benadryl and epinephrine work. I've experienced a person who became unconscious because of anaphylactic reaction, and it's scary. So you want to be someplace where somebody can take care of you and they know what they're doing.
Yes. Well, any last closing statement that you want to tell them before I close my?
I just want people to take care of yourself. It's pharmaceutical surgery, but it's really self-care, and it's your mind, body, spirit, all of that together. It's been COVID, COVID, COVID. Now it's vaccine, vaccine, vaccine. It's going to be stress and anxiety, and you got to calm down, pray, meditate, be kind, and just protect yourself. Self-care is so important, and you don't always need to go to your doctor, but you need your doctor to monitor that with you. That's like your partner, your nurse partner, your health coach, whoever it is, because we want to live to have a wonderful 2021 Christmas. We want to have so much fun this year.
Yes. So I agree. And thank you so much for being with me in our YouTube live here. And this is Dr. Maria Sulindro and Dr. Cynthia Shelby-Lane. We both are integrative anti-aging medicine. Dr. Cynthia from Detroit, Michigan, and I'm practicing in Pasadena, California. If you like this information, please share with your friends and or subscribe to our YouTube channel. And maybe you can click that bell notification and give us a thumb and write a question.
That's right.
And be sure
For
to
sure, thumbs up.
yes, thumbs up. Okay. Thank you so much, Dr.
Thank you.
Cynthia, and I'll see you again. Thank you.
Thank